Good afternoon, everyone. Will DuPree here in the KXAN live studio. And it's that time once again where we're all kind of thinking about the flu and what risks that might pose to us. Unfortunately, it's that time of the year where we have to do it yet again. Earlier today, Austin Public Health sent out this notice right here saying that there is higher than normal flu activity earlier for the season, which is a disconcerting thing to talk about. And the agency is also encouraging people to get their flu shots, of course. So to talk all about that, we have here today in the studio Dr. Mark Escott. Dr. Escott is the Interim Medical Director and Health Authority for Austin Public Health. Dr. Escott, thanks for joining us.
Happy to be here, and thanks for having me on.
Yeah, and before we jump into the questions that I prepared for you, I want to say that we are live right now on Facebook, so if you have any questions, you can leave those for us there, and we'll try to get to them. But first, Dr. Escott, I mentioned we have high flu activity here in the Austin area. What does that mean exactly?
So, Will, what we're seeing is quite concerning. From week 44 to week 45, we saw a 100% increase in activity. From week 45 to week 46, we saw another 100% increase in activity. Between week 46 and week 47, which was actually 2 weeks ago, it increased 275%. So we're seeing dramatic increases in that rate of flu activity very quickly and early in the season.
You may be looking at this graph that you sent me. Explain what this is showing exactly.
So what this is showing us is the percentage of positive cases. So if a doctor is testing for flu, what percentage of those flu tests are positive? And so we're seeing higher than 30% of those tests right now being positive, which again is a very early peak for us normally. We see that kind of peak later in January and February.
Someone may be looking at that and hearing that it's an earlier peak than normal. Why do you think that is exactly?
Well, we had some predictions that this may be the case. Australia, which is where we look for our indications of what's going to happen in the United States, had a record flu season this year, record number of deaths. And so that was an indication to us that this could be a bad season. The Southern Hemisphere immunization was redeveloped for the Northern Hemisphere. They made some changes, so we think the flu shot's going to be more effective here than it was in Australia and the Southern Hemisphere, but it only works if people get it.
Right, that's the main thing. What are you seeing here in the Austin area that's causing the most concern?
So most of what we're seeing right now is influenza B. Now, influenza B is bad, but it's not as bad as influenza A. What we are likely to see is a transition from flu B to flu A as the season progresses, and with that we expect more complications and deaths associated with that.
Right. Austin Public Health, in its release that was sent out earlier today, said that it's expecting a severe wave of flu illnesses if people don't get those flu shots. Why is that exactly, Dr. Escott?
Well, we know that immunization is the best prevention against flu, and by and large, that is our messaging to the public to try to prevent this trend from happening again this year. If we look back to 2017 to 2018, 79,000 Americans lost their life due to flu. And what we're seeing early in this season indicates that it may be worse than that this year, and now is the time to act to try to prevent that from happening.
If someone got the flu shot, say, today, how effective would it be? Would it be immediately? I would imagine not.
It takes about 2 weeks to be fully effective, but you start to develop immunity as soon as you get the shot. So now is the time so that you're prepared for January, February, which could be even worse than it is now.
Interestingly, this week is also National Influenza Vaccination Week. Who knew that existed, but I guess that's a very good thing. Dr. Escott, where can people find somewhere to go get a flu shot?
So there's a website that those with insurance can look on, vaccinefinder.org. They can put their information, it will tell them where to go. For those who are uninsured, Austin Public Health has low-cost or free shots for those that need it. Generally, pharmacies, physicians' offices, urgent care centers, lots and lots of places are offering. It's time to take advantage of this.
And how many cases of confirmed flu have there been here in Austin or Travis County, if you can kind of break down one of those areas?
So for Travis County, we've seen about 2,000 cases this year. 1,200 of those were last week.
And I would imagine that's unusual.
That is unusual, particularly this early in the season.
Yeah.
It's important for folks to remember that the flu shot is one of the greatest achievements in human history. the ability to vaccinate against flu. Just 100 years ago, 5% of the population of the world was killed by influenza. We have the technology now to prevent that kind of thing from happening. Let's take advantage of it.
We had reported previously about a school having to close for flu. We hear about that basically every year. Those things kind of happen, but the fact that one has already done that this year, and there's been a child death here in Texas from the flu, what do you make of that?
Well, again, it's a bit early in the season for us to see that. We can expect that if this is going to be a flu season, which it appears to be already, that we're going to see more and more schools join that. Our encouragement is that schools become active in promoting vaccination of their students so that we can try to prevent some of those school closings from happening.
Some people may wonder, is it too late to get the flu shot? Again, you just reiterated that the peak is not until January or February, so is it too late to get protected now?
It's not too late, and that's why this is vaccine week for influenza, because it's not too late. This is the prime time to get it if you haven't gotten already before that peak in January and February.
All right. And once again, remind people where they can find out where they can get a flu shot.
Vaccinefinder.org, or they can go to our Austin Public Health website for further information.
Some people may know what the symptoms are of the flu. What kinds of things should people be looking out for if they are experiencing something maybe a little bit uncomfortable at home or at work even?
Yeah. So generally we see fevers, coughs, body aches tend to be the big thing. There can be other things like nausea, vomiting, diarrhea as well. It's important though, when people start to develop those symptoms, particularly that fever, that they don't go to work, they don't go to school, they don't go to church, they don't go shopping, they go to their doctor's office to get treatment. It's critical that folks get treated in that first 48 hours because the medications that can help decrease the complications as well as limit the disease have to be started in that first 48 hours.
Reiterate that. You said 48 hours to really address the symptoms.
Yes, yes.
Why is that?
Well, because the medications work by stopping the viral replication process. After 48 hours, that virus has replicated so many times that it's like trying to stop a train. It's already done, and all you can do is suffer through it.
Yeah. Again, we are talking to Dr. Mark Escott with the Austin Public Health. He's here to talk about how Austin area is seeing a higher than normal flu activity for this early in the season. If you have any questions for Dr. Escott, we're taking them live on Facebook right now. I saw one just a few minutes ago, Dr. Escott, someone saying, how effective is the flu shot?
Well, we can tell you that after the season's done. It's a bit difficult to tell right now. The primary strains that we're seeing, influenza A and B, and the B subtypes that we're seeing are all in the flu shot this year. The flu shot's a quadrivalent shot, so it's covering the 4 strains, and all the strains that we're seeing currently are covered by the flu shot. So we're hopeful that if folks get the shot, it will cover them for these strains.
I'm looking at another comment here from Lisa Marie. She's asking, how long is someone contagious before they show symptoms?
It's hard to say. Generally, a day or two before, when they have that fever, they're going to be contagious, and they're going to be potentially contagious throughout that course of illness. Mm-hmm. That's why it's important for us to try to restrict their movement, try to stay home, and try to avoid infecting other people.
Right. What are you foreseeing for this flu season? Again, you mentioned there's a lot of cases at the moment. Where do you see this going from here?
Well, that depends on what the public does. If the public gets vaccinated and we get an effective vaccination rate throughout the community, we may be able to stop this rapid growth. But if we don't, we could see a record season this year.
For people, again, who they might experience some certain symptoms, what should people look out for in this case when they're thinking they might have the flu?
So again, that cough, that fever, that body ache tends to be the big thing people see. They feel like they've been hit by a train, something more than a usual cold. The challenge is that when people start getting the symptoms early, they think it's just a cold. When it gets worse, it may be too late. So the best advice is if you're developing symptoms of flu during flu season, see your doctor, let your doctor sort it out through testing and examination.
If you get the flu, what is some of the treatment for that to deal with it?
So there's a couple of different kind of medications. The traditional one that we use is Tamiflu, which is a medication given twice a day for 5 days. That medication is also very useful for treating other family members who may have been exposed to flu. So in households of people with confirmed flu, it's about 70 to 90% effective at preventing flu development in those who have not been diagnosed yet.
Sure. Again, we are talking to Dr. Mark Escott, who you see here in the KXAN live studio. We're talking about the flu. Already we're seeing quite a bit of activity here in the Austin area. Remind us, Dr. Escott, about what kind of activity has been in Austin at the moment.
So primarily what we're seeing is influenza B. We are seeing some A. It's about 25% influenza A and 75% influenza B. Again, we expect a transition of that influenza B to a predominant influenza A as the season goes on. And again, we may expect more complications when that transition happens.
This week, do you all have any numbers in about what activity has been?
So we have 1,250 confirmed cases from week 47, which was actually 2 weeks ago. So because it takes time to assimilate the data and get that reporting created, we're looking a little bit in the past, but that's a good predictor of what we're going to see in the future.
And what I feel is interesting is that you mentioned Australia being a good indicator of what might happen here in the U.S. Why is that exactly?
Well, we see the flu virus change as it travels around the world. And historically, when we look at bad seasons in the southern hemisphere, it generally equates to bad seasons in the northern hemisphere. So what we do is we look at what's causing the flu in the southern hemisphere, Australia in particular, and try to formulate the northern hemisphere shot based on what the primary strains were in Australia.
Right, and that's how we're doing it here in the U.S. now.
That's how we're doing it.
Yeah. Again, Dr. Mark Escott here with Austin Public Health. Is there anything that people should know that we have not addressed yet about the flu and the activity here in Austin?
Well, there's some good common advice for preventing the spread of disease. If you cough or sneeze into your bent elbow, just like this is showing you. It's many years ago, my kids came home from school and they taught me this, and I thought, what a great idea.
Right.
They didn't teach me that in medical school back then, but it's a great concept, and it really does help prevent getting that virus or other disease, bacteria on your hands, which then touches desks and doorknobs and so forth. So that's a great key element to try to prevent the spread of disease.
I always carry around with me some hand sanitizer. Is that a suggested thing to do as well?
Hand sanitizer is great. Wash your hands often. If you don't have running water and soap, hand sanitizer is fantastic. The other big advice is don't touch your face, your mouth, your nose, in particular your eyes. You can get bacteria or viruses on your hands. When it becomes an issue is when you introduce those to your mucous membranes via your face, that you actually get the infection.
I was just about to ask, why is that exactly?
Yeah.
Yeah.
Yeah, it's the skin is a good barrier against disease and infections. So when you expose yourself to mucous membranes, which don't have that same barrier effect, it's more easily spread via that method.
And you also mentioned before we came on about it being cyclical in a way, that the rise and fall happens about every 2 years where you see a lot of cases, then it kind of backs off a little bit. Why is that too?
Well, we have a bit of a very short-term memory when it comes to flu seasons. When we have bad flu seasons, people remember, oh, last year flu was very bad. I should get the flu shot this year. And then because more people get the flu shot, we have a less than active season than the prior year. And then their memory is of last year's season, I didn't get it, nobody I knew got it, so I'm not going to get the flu shot. And then we have a bad season again. So it does seem to be cyclical in that way.
One more time, if people are just joining us on Facebook, our website, or the KXAN News app, for someone who is looking for the flu shot, hasn't gotten it yet, what should they do?
They should go to our website at Austin Public Health or vaccinefinder.org, which will tell them where to go. They can put in their insurance information. It'll tell them all the places they can go to get their shot.
All right. Dr. Mark Escott there with Austin Public Health joining us here in the KXAN live studio. Thank you all for sending in your questions today. Before we go, Dr. Escott, is there anything that people out there should remember, take home, take note of at this point?
The biggest thing that we can encourage is getting that flu shot. Beyond that, if you have the flu, please don't go to work. Please don't send your kids to school. Please don't go shopping. Those are the two most effective methods at preventing the spread of this disease. And again, 2 years ago, we lost 79,000 Americans. We have a way to prevent that from happening this year. Let's all get together and get our shots.
Again, that's the flu shot. Dr. Mark Escott with Austin Public Health, thank you for joining us today, and thank you all for watching on Facebook and our website and our app. If you'd like to learn more, we have a story on our website right now with details about where, again, you can find a place to go and get your flu shot and some other information that might be helpful to you too. For now, thanks for joining us, and we'll see you back here very, very soon.